planned and invited the Permanent Secretary of Ministry of Health, Dr. Diana Twine, to be the chief guest to officiate over this annual All Partners Retreat, and to be accompanied by the Director General of Health Services, Dr. Henry Mubesa, to be the people to, grace this occasion. And they came. They came amidst all their tight program and schedules to make sure that they speak to the partners and every other person who was here in the meeting. In 2017, there was a conference in South Africa, and the world order that drive the aspirations through community health system strengthening organized a conference which was aimed at institutionalizing community health. Now, that conference drew participants from across Uganda and, of course, other countries within Africa and other continents. And the participants from Uganda who attended that meeting got challenged because it was discovered that there was need for countries to get into a situation where they should use community health as a vehicle that can deliver universal health coverage. It was discovered that if you don't have a strong community health system in the country, delivering primary care would be difficult. Number one thing was to see how do we institutionalize community health, both as a practice and as a service, so that we can ride on it to deliver primary care. In that conference was discovered that so many countries in Africa, including Uganda, did not have a national community health strategy. All these countries in Africa, there were 14 countries, they were all charged with the responsibility of coming up with what now came to be known as Community Health Acceleration Roadmap. How do you accelerate community health programs in countries so that you can achieve the universal health coverage targets? And so quickly in Uganda, partners together with the Ministry of Health came and sat together and said, let's draw up what we call Community Health Acceleration Roadmap. And one of the key deliverables of the roadmap was to come up with a national community health strategy. So that community health strategy development was very consultative, was very comprehensive, and it took the consultant together with duty bearers to run across the country to look at how do we come up with a strategy that speaks to the aspiration of this country we call Uganda. It brought partners together to see how do we facilitate the system that will develop for us this strategy. Now, towards the end of last year was when the document called the National Community Strategy was about to be completed. But we wanted it to speak to the minds of all Ugandans and including the partners who are actually the implementing partners. And it so happens that the elements now that constitute the 7 strategic directions of the National Community Strategy happen to be activities, some of which were already being implemented by partners. And partners said, we need to speak the same language, we need to build synergies, we need to sit together and see how these elements of the National Community Strategy can be put together. And we as partners see that if it is put together and is passed, it becomes a working document. How shall we implement it? That was the reason we came to Kalangala the first time, to make sure we quickly finalize that document, pass it, and it becomes a working document. So that was successfully done. And that document, which we now call the National Community Strategy, in 2022, in the month of February, it was launched by the Minister of Health of the Republic of Uganda, Dr. Jane Ruth Acheng, Minister of Health, launched it. It was a very, very big occasion. And so time came, we needed to see, do we disseminate the strategy? Do we implement the strategy? How best do we do it? So again, guidance from the Honorable Minister of Health, Dr. General Sachem, said, come up with an implementation guideline that will guide the implementation of this national strategy across all levels of implementation in this country by all partners. The implementation guide development for the strategy has kick-started. We are about to start taking this document for approval. But we thought that before the approval process starts, we need the input of all the partners who implement within the community health space. We need the ownership of all the stakeholders so that the implementation of this strategy becomes easy. That's how we thought of the second annual All Partners Retreat. It's an all partners retreat, but for only partners that implement within the community health space. We have so far registered close to over 68 partners that annually come here, sit together and plan for this country how community health structures, programs and system in this country can well be established.